I'm Dr. Jaron Banks. I'm a sports chiropractor, a master's in sports science and rehabilitation, as well as a doctor of chiropractic. And I have a lot of patients come to me with concerns or questions and seeking relief for headaches. And so it's one of the top 3 reasons that someone comes to a chiropractor. And so I want to share this presentation to address what causes headaches, what are the different types of headaches, and what can you do naturally to address the root cause of really what's going on, rather than just masking the pain or the symptoms with medication that sometimes has side effects that aren't healthy for the body. So not only are headaches a nuisance because of the pain, but let's talk about the real impact that they have on people's lives. You and I both know people that struggle with chronic debilitating headaches or migraines, and it can have a major disruption in your ability to function in your work, in your recreation and enjoyment, and in your relationships. It can be a major stressor. And so a couple examples that I have from patients that have come to me. Haley's a working mom, 2 kids, and she's a high-level manager for an insurance company. And when her headaches come on, when her migraines come, it's completely debilitating. She can't work, she can't take care of her kids or even herself very well. There's a college student, Jamie, who came to me who, after a car accident, started getting chronic recurring headaches, and they got to be so intense that she was missing classes, she was missing work, and started seeing a number of doctors and neurologists to try to get some relief. They're giving all kinds of different medications and getting some improvement, but still not enough to really be able to function as well as she needs to. And then lastly, I'll share how these people progressed over time. Lastly is Tim. He's a retired 72-year-old who he's struggled with headaches his entire life, and never tried chiropractic. He had tried a number of different medications, interventions. I didn't think that it would really help. And so, but it was, even after he was retired and not working in his career anymore, he was still getting these recurring headaches. And so this is what it looks like from day to day for some of these people. Some of the different types of headaches that you might experience are a sinus headache, where the sinuses get infected, they swell, and there's a lot of pressure built up in the cheekbones, in the forehead, around the eyes, and sometimes you could even have a fever with that. There are cluster headaches that kind of come in a series, intense pain behind the eye. Most common headache is a tension or a cervicogenic headache, which is coming from the neck or the muscles in through here, up into the head. You might feel that back here, on the top of the head, the sides, or across a band on the front. That's, again, one of the most common. Migraine headaches often have like a visual aura that precedes it. You might have some visual changes, and then when it comes on, whole half of your face is just pain, and these can be very intense and can be quite long lasting. And another common type is TMJ, where you can get pain in through here from issues with your temporomandibular joint. Now, there are over 150 different types of headaches. These are some of the most common, and I'll talk about how, different treatments that you can do for them. Before we cover any of that, I should let you know that there are some headaches that are an emergency. You should seek emergency evaluation and care. If it's a sudden, intense headache, if it's the worst headache you've ever had in your life, if you're having neurological symptoms like numbness, loss of muscle control, if you have a head trauma and a headache is getting worse and worse and worse and worse, those are reasons to seek emergency care. For the rest of the headaches, there are all kinds of books out there about where headaches come from. Let's talk about tips of things that you can do to get ahead of it. So one common treatment that you can do just for some quick relief is acupressure point in the web of your hand, massaging, pressuring in there. In some cases, can give you some pain relief. Massaging the temples has been shown in several studies to give some relief from headaches, especially these tension or cervicogenic headaches coming from the neck. Even massaging in some peppermint essential oil or smelling some lavender oil, both of those have been shown in studies to help give some relief. Drinking water, one of the first signs of dehydration is headaches. And so making sure that you are well hydrated, and many studies within 30 minutes of drinking water, there have been a reduction of the intensity of the headache. Getting enough sleep. Many studies have shown that people that get 6 or less hours of sleep pretty regularly have much more intense, much more frequent headaches than people that are getting a full night's sleep. And so you can get some recovery by catching up on sleep, but as a preventative measure, making sure that you have a good sleep schedule is very important. Avoiding alcoholic beverages. These will dilate the arteries, the vessels in your brain, and can contribute to headaches. Here are some herbs that have been shown in studies to help with headaches. Feverfew and butterbur have anti-inflammatory properties. They can help. There are some nutrients, some vitamins and minerals that if you're deficient in can make you more prone to headaches. And in some studies, consuming these supplements or even better, naturally from foods can help. So magnesium is one, vitamin B is another that often help, and CoQ10, which is a very powerful antioxidant that your body needs. Now, a dangerous belief that a lot of people have are that headaches are the problem. We think that the headache is the issue, it's the problem, but in reality, a headache is a symptom of an underlying problem. And so just like an iceberg, the tip of the iceberg is only a small part of the whole of the iceberg. Now, symptoms are body signals. It's a message from your body that something is wrong. And so are you listening? And what can we do about it? This is a wellness, illness spectrum that I like to talk about that gives us perspective on how we're addressing our health. Are we proactive or reactive? If you're having signs and symptoms, those are on the illness side of this spectrum. And if we're reactive with the way we take care of our bodies, we don't do a whole lot until we get this message that something is wrong, the symptom or the sign. And then we take something to try to address that symptom. Now, even better is to be on a webinar like this today, where you're getting better education and awareness of what are the root causes of these health problems? What can I do about it? And taking these healthy measures to stay ahead of it. And so, again, are you going to be proactive or reactive with your health and your headache? Because if you're just reactive to symptoms, only 10% of your nerves and your nervous system perceive pain. And so when you're having a headache, obviously some of those nerves are being triggered that there's a problem here, right? And so if only 10% of your nerves are detecting pain, if one of your other nerves is irritated or not well, if it's sick for some reason from being pinched, irritated in some way, it can have effects on other body organs and systems. The nerves that are going to your organs, to your hormone glands, to your muscles, all kinds of different body systems, and the balance of the health in your body can be affected if those nerves aren't healthy. And so a better premise than being reactive to symptoms like a headache is going to be to take health as the norm, that health is what we're striving for, that your body is smart, it's intelligent, and it knows how to self-regulate if something isn't blocking that. And your nervous system is the master control system that is regulating all of your organs, all of your systems. And your spine is your suit of armor that protects that. But modern life is unnaturally stressful to our spine, to our joints, to our nervous system. And so what's the answer? Another dangerous belief is that drugs work, that drugs cure or they fix headaches, right? Raise your hand if you know someone, maybe yourself, that is very quick to, take the Tylenol or the aspirin or whatever it is, because it gives you a quick relief. Well, the other dangerous belief is that, oh, if I just wait, maybe it'll go away. And these problems don't tend to go away. They may ebb and flow, but the underlying issue may still be there. And so let's talk about the stressors, the stresses that are at the root of a lot of headaches and stress on your nervous system, which is keeping your body healthy. So stress can come in the form of your thoughts, it can come in the form of toxins and chemicals, and it can come in the form of traumas to your body. Traumas, macro traumas like injuries, micro traumas like poor posture, having your head forward or down all the time on a device, or just repetitive motions in your work or in your daily routine. So neck is one of those micro trauma cumulative injuries that builds up over time. And we're seeing the effect of that on joints and muscles in the neck. And this is a major contributor to headache. Again, you're affecting the joints and the muscles. If your head is forward of your spine to any degree, it's going to add tension and weight. It makes your head feel heavier. It adds more tension in the muscles of your back and shoulders. So every centimeter forward is another 10 pounds of tension that is constant all day, every day. So it's not just your job thinking, I just carry my stress in my shoulders. The stress in your shoulders is coming from that posture to a large degree. And this can create a condition called the subluxation, where the joint is not healthy, it's not aligned right, it's not moving as well as it's designed to. And that can damage the muscles, the ligaments, it can irritate the nerves in the area and cause all sorts of problems in your health and your body. So your spine you could think of as a switchboard or a power box. And the different wires or nerves are going to different parts of your body, and those areas can be affected, not be as healthy as they should be if they're not communicating well with the other parts. So let's talk about the nerves coming from your upper neck into your head. This is where a lot of headaches are coming from. The nerves are irritated as they pass through these joints that may not be aligned or moving well. They're passing through muscles that may be tense, and those nerves are getting compressed and irritated. We commonly find on X-ray that in cases of chronic headaches or migraines, that there's a misalignment of the skull and the upper neck. And this is creating compression on one side, stretching and straining on the other side. This image shows some of those muscles. You have 6 layers of muscle that those nerves are trying to pass through to get to where they need to go and perform their function. And if those muscles are tight because of posture, because of an injury, because of just the way they have been aligned for a long period of time, those muscles are going to be tight, those nerves are going to be irritated. So stress headaches are one of the common types of headaches. They're tension headaches, and a lot of times they're coming from these different levels of the nerves in your spine. Sinus headaches, again, are coming from a sinus infection, and your sinuses, the nerves that are keeping your sinuses healthy, communicating there, are coming from these levels of your neck, C2, C6, C7. Migraine headaches can be triggered by let's talk about triggers. Let's talk about, a lot of people will say, my headaches or my migraines are triggered by smells, they're triggered by light, they're triggered by sounds, they're triggered by certain foods. There are a number of triggers that can set a headache or a migraine in motion. It can be hormonal with the menstrual cycle or with other hormone balance issues. If the joints and muscles and the nerves in your neck and head and in your spine are not well, you will be more sensitive to whatever triggers trigger your headaches or migraines. And so keeping those joints and nerves healthy is going to make a huge difference to how well you can adapt to or respond to whatever triggers or incidents happen in your day. So migraine, they can be associated with hormone levels again. C6 through T3 in your spine and L1 through L2 are going to be communicating with some of your hormone glands and can make an impact in those hormone levels. Another dangerous belief is that there's nothing that can be done. Some people just think they're stuck with migraine headaches. They think they're, they'll even call their headaches normal. Well, these are just my normal headaches. Headaches are not normal. They're not. And they're a symptom, they're a sign that something is not right. Something is not well in your nerves, in your arteries and vessels, and sometimes in those joints. And so there is something that can be done. Chiropractic care has been shown in research to be very effective at relieving the restriction in those joints and balancing those muscles and helping those nerves to be healthier. So 3 steps to addressing the cause is breaking bad habits of not sleeping enough, not getting enough hydration, not getting the proper nutrients that your body needs, and not staying in the same posture or same repetitive motions all day. Number 2, adding specific exercises that are going to be healthy for your spine and for your neck, and chiropractic adjustments to keep those joints and nerve healthy. So neck can lead to chronic neck problems, pain, degeneration of those discs. One exercise that we can talk about are Ys. Well, it's a series, Y, W, Ls, and Ts. So putting your arms up into a Y position, or down here, retracted in a W position, Ts, and then Ls. I don't remember. That's the YMCA, right? But doing Ys, main ones that I'd like to do are the Ys, Ws, and Ts, retracting the shoulders, retracting the chin. When your chin goes forward, not only do you cause tension in those muscles, you also compress the upper neck. And when you stretch your chin back, you open that space up and you stretch it. And so that's another stretch that is very helpful in these situations. So how do you know if you have a subluxation? Well, there are instruments that we can use to make some measurements. We can palpate the motion in the joints. We can palpate the position of those joints. We can see what your posture and alignment is like, and we can x-ray to see that alignment more visually. So another dangerous belief is that your problems will just go away if you ignore them. I've seen countless people who have struggled with this their entire life. We talked about Tim at the beginning, who's retired, 72 years old, still an issue even after the stress of a career is behind him. And after finally following the recommendation of some friends and coming in for chiropractic care, Tim finally, after a series of adjustments, had relief from his headache. Now, he still had an occasional headache, but they were not the intensity to limit his function to be debilitating anymore. He could play with family, grandkids, he could socialize without having such a major disruption anymore in his routine. Haley, working mom, high-level manager for an insurance company, no longer is having to miss work and family time and taking care of herself and her kids because she was able to make her neck healthier with some of these strategies that we talked about here, and with some regular chiropractic care. And then Jamie, after 3 years of chronic migraines and headaches debilitating, affecting her ability to fulfill her college classes, keep a job, and after seeing a number of doctors and neurologists, finally she was able to get relief to where it wasn't affecting her that way anymore. So it was life-changing for her, because her and the others, they had resigned to this feeling like thinking, I'm just going to have to live with this. This is normal for me. This is just what I have to put up with. This is just who I am. And that's not accurate. That's not true. There is something that can be done. And so if you struggle with headaches, or you know someone that does, encourage them to see a chiropractor. If you're in the local area, schedule a consultation with us. If you text special to 360-227-6522, we have a new patient special for you. If you're on this presentation, send us that message and we'll offer that to you. And our next presentation is going to be on sleep. So if you have issues falling asleep, staying asleep, if you would just like to get a better night's sleep and get more quality because you recognize that That's one of the biggest determinants of your health and function each day. Tune in 3 weeks. I don't have the date here, but tune in and we'll be talking about that. So thank you for joining in, and I hope this helps. Leave a comment or question below if there's any other issues I can address. You can also put those in the chat if you're on the live presentation here. And I'll share one more story. Let me just close out of here. I'll share one more story with you. So I had another patient, Jill, and she had a rare condition associated with migraines. It's called cyclical vomiting syndrome. So you can imagine what this was like. She would get these migraines pretty regularly, at least a couple times a week, and it would cause her to vomit almost constantly. And so she had a PICC line, which is, a feeding tube basically into her arteries to give her nutrients because she couldn't keep food down. So she was 29 or 30 years old when she came to me. She had seen a number of doctors and specialists across the country trying to figure out how to treat this condition. She had not had chiropractic care, and someone had recommended she try it. So she came to us as a last resort. She came in, we did the consultation evaluation. We found this kind of a misalignment at her skull and neck, and we started making some adjustments. And after a series of adjustments, she said her headaches were improving. They weren't as intense, they weren't as frequent. And so we continued our care. Things were working. We were working with the muscles around there. We were working with the joints, improving the alignment and the mobility. The nerves in her neck got healthier. The joints got healthier. The muscles got healthier. Her headaches became less and less frequent, less and less intense. She no longer needed that PICC line tube. It was one of the best days of her life when that thing was removed. And now she lives a normal functioning life. Whereas before, it was completely debilitating. She could not function with that. And so I hope that by me sharing this information and these stories, that you are equipped to help yourself or others that you know or others that you come across to have hope that there is a solution, that there's something that can be done about this root cause underlying most headaches. Even if the issues with the joints and the nerves of your neck are not the root cause, they are a major contributing element to headaches and migraines. And so keeping that healthy makes a world of a difference. And